Greetings, aspiring nurses. Welcome to another pivotal lesson in your journey to becoming healthcare experts. Today, we delve into a topic that is frequently underestimated, yet profoundly significant: urine. Yes, you heard correctly. Specifically, how we can manipulate it to benefit our patients. This is where diuretics come into play. These seemingly simple pills are instrumental in patient care. Diuretics facilitate the elimination of excess fluid, primarily water and sodium, through urination. This process is crucial for maintaining the body's fluid equilibrium and ensuring optimal organ function. But why is this so critical? Consider conditions such as heart failure, where fluid accumulation in the lungs impedes breathing, or hypertension, where excess fluid exerts additional pressure on the heart and blood vessels. In these scenarios, diuretics can be life-saving. Diuretics function like plumbers for the body. Just as a plumber clears obstructed pipes to alleviate pressure, diuretics expel excess fluid, reducing the strain on the heart and other organs. This renders them indispensable tools in managing a broad spectrum of health conditions, from chronic ailments like hypertension to acute issues such as pulmonary edema. However, like any potent tool, it is imperative to comprehend how diuretics function and how to administer them safely and effectively. Misuse can result in dehydration, electrolyte imbalances, and other complications. That is what we will explore today. We will examine the various types of diuretics, their mechanisms of action, and the best practices for their administration. So prepare to become diuretic experts. By the conclusion of this lesson, you will possess a comprehensive understanding of how to utilize these medications to enhance patient outcomes and elevate your nursing practice. To truly grasp diuretics, we need to zoom in on the kidneys, specifically those microscopic filtering units called nephrons. These nephrons are the fundamental building blocks of kidney function, working tirelessly to filter blood and produce urine. Each kidney contains about 1 million nephrons, and they play a crucial role in maintaining the body's fluid and electrolyte balance. Imagine nephrons as tiny tubes with different sections, each responsible for reabsorbing or excreting substances. These sections include the glomerulus, proximal tubule, loop of Henle, distal tubule, and collecting duct. Each part has a unique function in filtering blood, reabsorbing essential nutrients, and excreting waste products. This is where diuretics step in, like stealthy ninjas. They are medications designed to increase urine production by interfering with the normal reabsorption processes in the nephrons. By doing so, they help the body eliminate excess fluid and sodium, which can be beneficial in conditions like hypertension, heart failure, and edema. Each type of diuretic targets a specific section of the nephron, blocking the reabsorption of sodium. For example, loop diuretics act on the loop of Henle, while thiazide diuretics target the distal tubule. Potassium-sparing diuretics, on the other hand, work on the collecting duct. By blocking sodium reabsorption, these medications prevent water from being reabsorbed, leading to increased urine output. By doing so, they trick the body into flushing out more water along with the sodium, increasing urine output and reducing fluid volume. This reduction in fluid volume can help lower blood pressure, reduce swelling, and alleviate symptoms of fluid overload. However, it's important to monitor electrolyte levels, as diuretics can also lead to imbalances in potassium, magnesium, and calcium. The location of this sodium-blocking action determines the diuretic's potency and side effects. For instance, loop diuretics are very potent, but can cause significant electrolyte disturbances, while potassium-sparing diuretics are less potent, but help maintain potassium levels. Understanding how diuretics work and their specific targets within the nephron can help healthcare providers choose the most appropriate medication for each patient, ensuring effective treatment with minimal side effects. Let's start with osmotic diuretics, the heavy artillery of the diuretic world. These agents, like mannitol, work by increasing the osmotic pressure in the nephrons. Picture this. Imagine pouring a ton of salt into a glass of water. The water rushes towards the salt, trying to dilute it. That's essentially what osmotic diuretics do inside the nephrons. They draw water from the surrounding tissues into the tubules, creating a flushing effect. Osmotic diuretics are primarily used to reduce intracranial pressure and cerebral edema, not so much for everyday fluid management. Next up are loop diuretics, The powerhouses like furosemide, also known as Lasix and bumetanide. These agents target the loop of Henle, a specific section in the nephron, and they don't hold back. Loop diuretics are incredibly effective at blocking sodium reabsorption, leading to a rapid and significant increase in urine output. This makes them ideal for treating conditions like acute pulmonary edema and severe edema associated with heart failure. However, their potency also means they can lead to significant electrolyte imbalances, particularly potassium loss. Section 5. Thiazide diuretics, everyday champions. Thiazide diuretics, such as hydrochlorothiazide, are like the reliable workhorses of the diuretic family. They work in the distal convoluted tubule of the nephron, another key site for sodium reabsorption. While not as potent as loop diuretics, thiazides are still very effective in managing hypertension and mild to moderate edema. They're often the first-line treatment for high blood pressure due to their relatively gentle action and favorable side effect profile. Section 6. Potassium-sparing diuretics, holding on to the essentials. Last but not least, we have the potassium-sparing diuretics like spironolactone and amiloride. These agents work differently from the others. Instead of directly blocking sodium reabsorption, they interfere with the action of aldosterone, a hormone that promotes sodium retention and potassium excretion. This unique mechanism allows them to increase urine output while conserving potassium, making them valuable additions in certain situations, especially when combined with other diuretics to prevent potassium loss. Section 7. Patient education, empowering your patients with knowledge. As nurses, our role goes beyond administering medications. We're also educators, ensuring patients understand their treatment plans and potential side effects. With diuretics, patient education is crucial for both safety and treatment adherence. Let's break down some key points to cover for each type of diuretic. Section 8. Osmotic diuretics, patient teaching tips. For patients on osmotic diuretics like mannitol, explain that they might experience increased thirst and urination. Emphasize the importance of monitoring fluid intake and output as directed by their healthcare provider. Additionally, inform them about potential side effects like headache, dizziness, and electrolyte imbalances. Section 9. Loop and thiazide diuretics, patient teaching tips. When it comes to loop and thiazide diuretics, potassium loss is a major concern. Teach patients to recognize the signs of hypokalemia, such as muscle weakness, fatigue, and irregular heartbeat. Encourage them to consume potassium-rich foods like bananas, oranges, and leafy greens, unless contraindicated. Stress the importance of regular blood work to monitor electrolyte levels. Additionally, advise patients to take their medication in the morning to avoid nighttime urination. Section 10. Potassium-sparing diuretics, patient teaching tips. For patients on potassium-sparing diuretics, emphasize the importance of avoiding excessive potassium intake. This includes limiting high-potassium foods and salt substitutes that contain potassium. Inform them about potential side effects like hyperkalemia, which can manifest as muscle weakness, fatigue, and slow heartbeat. Encourage open communication and regular follow-up appointments to address any concerns or side effects they experience. Section 11. Mastering diuretics for the NCLEX, what you need to know. This section is crucial for your success on the exam and in your future nursing career. All right, future RNs, let's ace that NCLEX. Diuretics are a significant topic, and understanding them thoroughly will give you an edge. Remember these key points. Understand the mechanism of action for each diuretic class and where they work in the nephron. This includes knowing how loop diuretics, thiazide diuretics, and potassium-sparing diuretics function. Know the common uses, side effects, and nursing considerations for each type. For example, loop diuretics are often used for conditions like heart failure and edema, but they can cause significant electrolyte imbalances. Focus on electrolyte imbalances, particularly hypokalemia and hyperkalemia. These imbalances can have serious consequences, so it's vital to recognize the signs and symptoms. Be prepared to answer questions about patient education, including dietary modifications and potential drug interactions. Educating patients on the importance of maintaining a balanced diet and monitoring their electrolyte levels is key. With a solid understanding of diuretics, you'll be well on your way to conquering the NCLEX and becoming amazing nurses. Remember, confidence and knowledge go hand in hand. Keep studying, stay focused, and believe in your abilities. Your hard work will pay off, and soon you'll be making a difference in patients' lives every day.